After standard lateral decubitus positioning and prepping/draping, the surgeon uses sterile conventional bandages to prepare to wrap the patient's forearm. Starting from the distal 2/3 of the forearm, the sterile bandages are wrapped longitudinally along the axis of the arm towards the distal end, passing circumferentially around the fingers and back up the forearm, overlapping sugar tongue fashion on the volar and dorsal aspects of the distal 2/3 of the forearm. The bandages extend 3 to 4 centimeters distal to the fingers. To ensure adequate final strength, the sterile bandages can be wrapped repeatedly for 5 to 6 layers. The surgeon then lifts the patient's forearm, with one hand holding the wrist to stabilize the position of the conventional bandages and forearm, forming a ring structure with the bandages distal to the fingers. The other hand grasps the ring formed by the bandages anterior to the patient's forearm. The assistant uses a Coban starting at the wrist, wrapping 2 to 3 circles around the wrist to secure the forearm bandages. The assistant then continues wrapping proximally up the forearm until covering all the bandages on both sides of the forearm, with 2 to 3 additional reinforced circles. The Coban is then wrapped distally, passing the wrist and wrapping circumferentially around the hand and fingers. Subsequently, the assistant pulls on the bandage ring to abduct the shoulder joint approximately 45 degrees. Another assistant hooks the bandage ring onto the arthroscopic shoulder positioner and hangs a 10 pounds weight distally for shoulder joint traction. To avoid potential contamination, the assistant at the bedside changes gloves after completing the hooking maneuver. The connection point between the bandage and traction frame is wrapped with a sterile towel.